Welcome to the Voice of Autism Resource Hub. We exist to support caregivers who are new to or feeling overwhelmed by raising children with autism spectrum disorder. This guide offers practical, immediately usable advice in three core areas: understanding communication, managing challenging behaviors, and prioritizing caregiver self-care. Our tone is empathetic, empowering, and supportive. View this as a guiding first step, not an exhaustive manual.
The most effective therapeutic approach for nonverbal children with autism spectrum disorder, ASD, is a comprehensive multidisciplinary intervention model. This approach leverages a team of specialists to address various aspects of development: language, motor skills, social skills, and emotional regulation simultaneously. The sources present an integrated protocol called the Combo 5 for comprehensive intervention in young children, 0 to 6 years old, with delayed language, which provides superior efficacy for children who are nonverbal.
Core multidisciplinary components, the Combo 5. The Combo 5 integrates 5 essential therapies, emphasizing that these therapies do not work independently but rather complement each other. 1. Speech-language therapy, SLT. SLT is considered one of the main and most effective solutions for delayed speech. Key goals and techniques for nonverbal children. Ultimate goal: the primary objective for moving a nonverbal child toward verbal communication is establishing verbal imitation. Imitation should be taught step by step, starting with simple actions, moving closer to the mouth for simple sound shapes like continuous vowels, and finally progressing to word level.
Optimal approach. The hybrid approach is considered the optimal model for children without language, as it integrates targeted techniques into natural play context, balancing structure with engagement. Prerequisites. Focus must first be placed on learning to learn skills, which means ensuring the child is ready to learn by being able to sit, wait, and follow simple instructions. This often involves the behavioral concept of manding, requesting, where a child learns to ask for desired items.
Core SLT techniques. Focused stimulation. The therapist, parent, repeatedly uses a target word or phrase in conversation or play, allowing the child to absorb the word naturally without being required to repeat it. Parallel talk and self-talk. The adult describes what the child is doing, parallel talk, or what the adult is doing, self-talk, to provide a rich language environment and connect words with actions or objects. Creating communication opportunities. Strategically placing desired items slightly out of reach or creating sabotage in activities encourages the child to use communication, gestures or sounds, to express needs.
2. Music therapy, MT. Music therapy uses music to improve physical, emotional, cognitive, and social needs, and is an effective means of interaction for children with ASD/RLPTK, especially those who struggle with verbal communication. Effectiveness for autism nonverbal children 0 to 3 years. Music, as a nonverbal language, offers a unique pathway for engagement. It activates multiple brain regions, enhancing listening ability, comprehension, and language expression. It promotes emotional regulation, reduces stress and anxiety, and stabilizes mood, creating a calm state conducive to learning and interaction. It encourages social skills like joint attention, imitation, and turn-taking. It improves motor skills, coordination, and control of the mouth, tongue, and breath through rhythmic and active participation.
MT implementation. Active music therapy, e.g., singing, playing simple instruments like drums or maracas, rhythmic activities helps develop motor skills, social interaction, and motor control necessary for articulation. Passive music therapy, listening, is used to regulate emotions and create a state of relaxation. Nonverbal classical music is specifically recommended for children 0 to 3 with RLPTK due to its structured patterns, clear melodies, and predictable rhythms, which help reduce sensory overload and provide a sense of safety. Listening sessions should be short, 10 to 30 minutes, and highly individualized based on the child's observed reaction and sensory profile.
3. Play therapy. Play therapy is crucial for promoting symbolic thinking, which is a core skill for language development, and for integrating language into real-world contexts. Techniques include functional play, using objects for daily activities like eating, pretend play, exploring roles and imaginative scenarios, and cooperative play, group activities requiring communication and negotiation. Play encourages the natural application of SLT techniques like parallel talk.
4. Motor therapy. Because language is a complex motor skill, motor intervention is necessary to support the foundational skills required for speaking. OT focuses on fine motor skills, sensory processing, and daily activities. Oral motor exercises are a direct link between motor and language development, aimed at strengthening and controlling the articulatory organs, lips, tongue, jaw. Examples include deep breathing exercises, moving the tongue in various directions, blowing bubbles or candles, and using a straw.
5. Psychological behavioral intervention. This targets underlying emotional barriers, as anxiety or frustration can prevent a child from communicating. Goal: decrease anxiety, increase self-confidence, and teach children to use functional communication skills instead of engaging in disruptive behaviors. Techniques: establishing a non-pressured environment and using behavioral therapy to improve emotional self-regulation and social interaction. Augmentative and Alternative Communication, AAC. For nonverbal children, the Picture Exchange Communication System, PECS, is a highly effective augmentative and alternative communication, AAC, method. Purpose: PECS was originally developed for preschool children with ASD and other developmental disabilities who had not developed useful language and did not initiate communication. It is particularly useful for nonverbal children with limited speech. Mechanism: PECS teaches the child to initiate communication by physically exchanging a picture representing a desired item with an adult. Benefits: PECS is successful across various ages and abilities, helps reduce frustration, teaches the cause and effect of communicating, and, for some users, may support the development of subsequent speech. Implementation: PECS is an explicit process requiring instruction from a trained professional, often a speech therapist. Parents are encouraged to seek intervention for PECS mastery.
You know, if you're a parent or a caregiver and you're feeling that mix of hope and worry about your child's communication journey, it can really feel like you're trying to navigate an unmarked map. Well, today we're going to change that. Together, we're going to draw that map, giving you a clear, step-by-step guide to support your child's path to language. So let's get started. Here's our game plan. First, we'll get a really clear picture of the challenge itself. Then, we're going to focus on the one skill that unlocks everything else: imitation. After that, we'll explore the whole child approach, dig into a toolbox of practical strategies, and finally, we'll talk about the most important person in this journey, and that's you. All right, first things first. Let's get our bearings. Before we can go anywhere, we have to understand exactly what we mean by language delay and, just as importantly, realize how many other families are on this exact same path. Just let this number sink in for a second. 20%. That's 1 in every 5 kids. So if you're worried about your child's development, the very first thing I want you to know is this: you are absolutely not alone. This is a shared experience for millions and millions of parents out there. Now, the clinical term you might hear for this is late language emergence, or LLE, All that really means is that a child isn't hitting those typical language milestones for their age. Things like not babbling mama or dada by 12 months, or not putting two simple words together like more milk by the time they're 2. Just being able to name it is the first real step toward getting the right help. So, we've defined our starting point. But before we start talking about all the different therapies and techniques, we have to know where we're actually going. What is the real destination we're trying to reach with all this work? It sounds like a simple question, doesn't it? But the answer is really the key that unlocks everything else. See, it's not just about getting a child to say words. It's about teaching a much, much more fundamental skill first. And this quote just nails it. It really gets to the heart of everything. The ultimate goal is verbal imitation. It's the ability to see something or hear something and then copy it. Think about it. Without that foundational skill, learning a language is basically impossible. So every single strategy we're about to discuss is really just trying to build this one single ability. Okay, so if our destination is imitation, how in the world do we get there? Well, the answer isn't just about practicing sounds over and over. Language is so deeply connected to everything else. A child's emotions, their social skills, even how they move. So let's look at how we build this skill with a more holistic strategy. This idea is at the very core of a really comprehensive model called the Combo 5 approach. It's all built on a simple but incredibly powerful idea. You just can't separate language from the rest of a child's development. It doesn't happen in a vacuum. A child who feels anxious or who struggles with motor control is going to have a much harder time learning to communicate. So let's see how these therapies all work together, like a team. You've got speech therapy right at the center, and you can see it's often recommended pretty intensively, like 3 to 5 times a week. But look at how it's supported by everything else. Music and behavioral therapy help regulate a child's emotions, making them feel safe and ready to learn. Play therapy helps build social skills. And motor therapy strengthens the very muscles in the mouth that they need to form words. It all works together. Let's just zoom in on music therapy for a second, because it's a perfect example. This is so much more than just singing songs. Music has a scientifically proven ability to calm the nervous system, which puts a child in a much more receptive state for learning. The back and forth rhythm of a song naturally teaches turn-taking, a vital pre-language skill, and it's all done in a way that's incredibly fun and engaging. Okay, so we have our destination, imitation, and we have our holistic path. Now it's time to open up the toolbox and look at some of the specific systems and techniques that you're probably going to encounter on this journey. This is maybe the most pressing, heart-wrenching question for caregivers. That feeling of frustration for both the child and the parent when basic wants and needs can't be communicated, it's just immense. So what tools can we use to bridge that gap right now? Well, one of the most common tools you'll see is something called PECS, which stands for the Picture Exchange Communication System. The idea here is just brilliant in its simplicity. Let's establish functional communication immediately. A child learns to hand over a picture of what they want, an apple, a car, you name it. This teaches them to initiate communication, and it can dramatically, and I mean dramatically, reduce frustration. Now, it is so important to understand that these two approaches are not in conflict. They aren't an either-or situation. They're just different tools for different jobs. Think of PECS as the strategy for right now. It builds functional communication to ease that immediate frustration. Verbal imitation shaping, on the other hand, is the long-term strategy, the one designed to build that foundational skill of imitation that will hopefully pave the way for actual speech. So how does this shaping thing actually work? It's really this brilliant step-by-step process. First, you just teach waiting with an open palm. This establishes control and the idea of taking turns. Then you move to imitating simple physical actions, like touching your nose. The goal here isn't the action itself. It's just to teach the concept of copying. Next, you bring that imitation closer to the mouth, copying mouth shapes, but with no sound. And only then, as the final step, do you add sound, starting with simple vowels like ah or oo. It breaks this huge, overwhelming task into tiny, achievable steps. We've talked about philosophies, we've talked about therapies and tools, but now we need to talk about the single most important element in this entire equation, the person who will be the true guide on this journey. This just says it all, doesn't it? Therapists are absolutely essential experts, but they might only see your child for a few hours a week, max. The real magic, the real sustainable progress, that happens with you. It happens in all those small moments woven throughout your everyday life at home. You are the primary therapist. So what does this actually look like in real life? It's all about turning your daily routines into learning opportunities. You can use parallel talk, that's just you narrating what your child is doing, or self talk, where you narrate what you're doing. You can even create little sabotage moments where they need to communicate with you, like putting a favorite snack just out of reach. These aren't extra chores. They're just small shifts in how you interact that create this rich, supportive language environment all day long. We have covered a lot of ground today, from understanding the challenge to defining our goal as imitation and exploring all the different tools in the toolbox. The journey ahead, it requires patience and it requires consistency, but it is not an unmarked map anymore. You have a guide. So the only question left is, what small step are you going to take today to start building that bridge? Because every word, every song, and every shared moment is another stone in the path forward.
Therapy quiz. Q1. According to the Combo 5 report, what is the primary rationale for using a multidisciplinary approach for a child with late language emergence? A. It focuses exclusively on intensive speech-language therapy as it is the most critical component. B. It allows parents to choose the single therapy that works best for their child. C. It is a requirement for insurance reimbursement for speech therapy services. D. It addresses the interconnected nature of a child's development, where language issues are often linked to emotional, social, or motor skills. Q2. A therapist is playing with a child and says, "I am building a tall tower. Now I am putting the red block on top." Which specific speech-language therapy technique is being demonstrated? A. Focused stimulation. B. Parallel talk. C. Self-talk. Or D. Creating communication opportunities. Q3. For a nonverbal child who finds highly structured, drill-based activities overwhelming, the Combo 5 text recommends which therapeutic approach as the most optimal. A. The clinician-directed approach. B. The child-centered approach. C. The Picture Exchange Communication System, PECS. Or D. The hybrid approach, HA. Q4. What is the primary therapeutic goal of receptive music therapy as described in the source materials? A. To encourage the child to sing along with repeated phrases. B. To regulate the child's emotions and reduce anxiety by having them listen to music. C. To develop turn-taking skills through call-and-response songs. Or D. To teach a child to play a simple musical instrument.
Announcement. First course for special education teachers, specialized tutors, parents, interventionists who want to understand the 40H model plus 100 combos of evidence-based interventions from EBI or EBP, starting from 1/11/2025. Online and free, online and free. Learners who know English, Japanese, Korean, please notify in advance. Subscribe to the channel to receive the link to the course link.